Sometimes it's hard to know if your child's big feelings are just a part of growing up or if your child is experiencing a mental health crisis. Here are some tips to help you determine what to do if you identify a problem.
There can be many signs indicate that a child is experiencing a mental health crisis. One of the most important psychiatric problems in pediatric age group is depression and suicidal ideations. Having a suicidal ideation can be a serious sign of a serious depressive episode. For example, we can see kids talking about wanting to die. We can see kids having plans about how they can end your life. So this can be a serious sign, and it warrants an evaluation with a psychiatrist.
So our oldest son, he's on the autism spectrum.
When our nephew passed, it was difficult for him, and we knew he was struggling, but we didn't realize to the extent that he was struggling until he was severely struggling, until I think we got notified by the school.
Realizing that he was struggling with a mental health crisis caught up with us pretty quickly. We knew that he was struggling with grief, but we just didn't realize how heavy that it was until we were in a state of crisis. He was saying, I want to hurt myself, and then very quickly was saying, I don't want to live anymore, and had a plan for how he was going to do that. And I feel like that snuck up on us pretty quickly.
Identifying children with mental health concerns can be a challenging thing to do. For example, if you look at the elementary school kid, going to school, hanging out with friends, maybe not able to pay attention to their classes, having impulsive behavior can be a sign of attention deficit hyperactive disorder. So this needs to be evaluated by a physician. When we look at the older kids, let's say teenager period, we see more like mood problems. We see teenagers being more upset and down and experiencing depressive symptoms, and then we may need to focus on that kind of symptomatic presentation.
The school played a huge role in helping us identify how he was struggling. He hadn't said that he wanted to hurt himself at home, so at school was the first time that he verbalized that. And I just felt so thankful that he had people at school that he felt that he could trust to say that, and that they took it seriously and didn't just write it off as a teenager saying something or just trying to get out of a test, but they took it serious enough to make sure that they were keeping him safe and to notify us so that we could do the same thing.
School counselors or teachers can be a really like a good source of being a partnership. First reason is that usually teachers or counselors are having a better chance of seeing a child's behavior at school. They see how the kiddo is interacting with other friends and how the academic functioning, if there's any abrupt change.
I mean, we're not medical professionals. We didn't know what to do. It was terrifying, you know? It's just listening to the people that we've built relationships with, like his psychiatrist. That was the first person we called and kind of, this is what's going on and what do we do?
You want to be strong for your children, but you also want them to see that healthy emotion. So heading into the emergency department was tough, and then taking him to an inpatient facility was even more difficult.
There can be several resources for parents to address concerns related to their kids. For severe symptoms, pediatricians should be the first contact point, and they can also get some resources for local psychiatric providers. Second is that they can also reach out to counselors, so kids can have some initial support, can learn some skills, how to explain themselves and how to talk about their emotions. This can be another resource. And if you feel like your kid is having an emergency condition, let's say if your kid is talking about wanting to die or having a plan or actually attempted to suicide, then you need to think about an emergent setting to address some of the concerns that you are having. For example, going to an emergency room can be a good starting point so they can have an assessment and they can help what type of treatment your kid needs.
So I think the critical thing was taking him serious. I guess err on the side of caution.
Just being able to reach out and look and ask for help, and knowing that it's okay to ask for help. Sometimes as a parent, you think that you can handle everything, and sometimes you can't, and it's okay to reach out and to ask for help and start just kind of looking and seeing what's available I think it's very important to know about the red flags early because mental health doesn't always look the same in children as it does in adults.